The coronavirus is obviously the biggest story of the year, and perhaps it's going to turn out the biggest story of the decade. Now, I'm hoping to look at things from a bit of a different perspective than you've probably seen on most of the mainstream media reports. I wanted to look at some of the global responses, compare them to what's been going on in Canada, and really see what is the plan going forward. So the first place that I wanted to start is this really excellent website. It's called endcovid2019.live. So this website basically is a compilation. It sorts all of the reports, the confirmed reports, the deceased, recovered, and the serious. So it gives you a bit of a chart, and you get all the information sort of at a glance. Now you can see which country is obviously leading, and that's still China because that's where the outbreak started. But Italy and Iran are obviously up there. Certain countries you may not have been aware of: Spain, Germany, France, the US, UK. These are all getting up there, creeping up, and you've heard a lot about flattening this curve. And so, this is a good website to be able to check where you can kind of compare, see where countries are going and what's been going on. Now, in Canada, we've heard that the government wanted to institute some checking at the airport, that they were going to review passengers who came. We have Minister Bill Blair discussing, that they're going to be having some enhanced security procedures. And here we have Matt Gurney tweeting about the fact that this is not true at all. Most of the media reports and reports on Twitter have people saying that, all they're getting is a question: have you been to a COVID-19 hotspot? And if you have, here's a pamphlet. So the enhanced measure is not quite sure what they're supposed to be, if it's going to be taking people's temperature. It's going to be something more invasive than that. But so far, until this point, until the recording of this video, a lot of people, probably the vast majority of them on Twitter and online, claiming that nothing like this exists. Now, you're not going to be surprised that a CBSA officer, a Border Patrol officer at Pearson tested positive for the coronavirus. Again, he's seeing people coming in from, he or she doesn't say actually, they're seeing people coming in from all over the world. Undoubtedly a number of them are infected. If we go just quickly back to the COVID 2019 website, so you'll see that this is the confirmed cases. Now, that's people who have been tested and are confirmed to have it. So we're looking here 167,000 globally. That means there are quite a higher number that have the coronavirus but have not been confirmed. So this is where you're going to get the CBSA, and this is obviously the big concern, that people who are not confirmed to have it are going to be spreaders or super spreaders, as we'll get to a bit later. So then you have here a nice tweet from Natasha Fata, daughter of Tarek Fata, for those of you who might not know. So she's reporting that the government is going to be making a breaking announcement tomorrow, which is kind of weird on its own. Why would they be making an announcement saying that they're going to be making an announcement? There were rumors online that there's going to be a lockdown. There's rumors online about all kinds of different things. Now keep in mind, these are just rumors, and possibly by the time you even watch this video, you'll obviously know what has happened. But I think overall Canadians want to know what is going on, what is the plan, is there a plan, because the responses have been seeming so lax. A number of my colleagues, my True North colleagues, have been covering this issue very, very well. So definitely check out some of their content, but clearly we're going to be waiting for tomorrow to find out what the announcement is. But around the world, we have, for example, Italy. So there's a lot of news in Italy, and here's a nice report. This is in the Boston Globe, and it's a cautionary tale from Italy. So the cautionary part is this, and that's because the healthcare system was not prepared, because of the way that things were set up and the amount of patients coming into the ERs, coming into the hospitals. So you have here, according to this, a situation where doctors are forced to make decisions over who they're going to admit, who's going to get a ventilator, who has the best chance of living, who should we focus on, who are we going to triage first. And this is the type of decision making that generally occurs during wartime. You don't generally expect this to happen during peacetime. This pandemic, I want to say that it came out of nowhere, but it really didn't. We had some warning from China. Obviously they tried to downplay, and the information was sparse and few and far between, but that's what the experts are there to help us decode the mixed messages. And so, now they've reached a situation where doctors really just have to decide on a certain level who's going to live, and who's just, going to take their chances. Other countries, France is going to close all restaurants, cafes, cinemas due to fears about the coronavirus. That's pretty crazy. There was some line here that they're closing, everything non-essential to French life, which is kind of funny because you would figure, stereotypically you think a cafe is pretty essential, but these are some pretty intense measures. No public places, nothing at all. You have here the governors of Ohio and Illinois issuing orders to close restaurants, bars, big public gatherings, that kind of stuff. So people are definitely concerned that they shouldn't catch this virus. People are taking it very, very seriously, and measures, some people think it's extreme, but this is one way to prevent the spread. Just don't go anywhere, and if you are forcing people to not hold these events, to not have the places open, then there's nowhere they can go, theoretically, which is the idea. Then you have here Russia. Russia is quite the interesting case. This is from March 15th, so this is a very recent one as for the time of making this video. So Russia had 63 cases of the coronavirus. Now, the two interesting things is that, first of all, Russia closed its borders with China very, very early on. So they closed the vast majority. Now, they have a huge border. I think it's like 4,300 kilometers long border. A massive, massive border with China. And they closed the entire border, except for apparently a few very small minor crossings. And so they acted early on. But at the same time, 63 does seem a bit low considering the incubation period. So, you're wondering kind of, perhaps there were other people that did get this virus. Maybe it didn't affect them so badly. Maybe they simply thought it was a cold or a flu. So you're kind of wondering what happened. But clearly you can see that Russia's, immediate action on closing the border. Here's a nice map of the cases. But their immediate action on closing the border seems to have saved them from quite a larger outbreak. Now we turn to the Middle East. So Israel actually has some really interesting measures. So apparently the government has approved cell phone tracking. So if you are in isolation, apparently they're going to be tracking your cell phone. So they make sure that you actually don't leave the house. And they've done a lot of things. They've put a total ban on public gatherings over 10 people. So that means basically there's no synagogue, no church services, no religious services of any kind. For those of you who want to go out anywhere, there's nothing. There was actually a funny tweet about a couple who got married at the grocery store because the grocery store doesn't have those restrictions, because people are allowed to, go to and from the grocery store. And if there's 10 or more, obviously that's who's in the grocery store. So apparently people getting married at the grocery store, which is weird. Religious sites and everything obviously closed, so nothing more than 10 people. That's a pretty high number. Now, the other interesting point that not this article, but that comes to mind when reading about Israel, is the fact that a lot of the countries that are able to institute these responses are countries that have very strong governments and strong institutions. So this is a different article from the Atlantic Council, and basically discusses the fact that weak states that do not have so much control are simply unable to take these type of measures. So other countries, Syria, for example, which is in shambles, or, countries that their government is not as strong, does not have that reach. So they're not going to be able to, mass mobilize these groups of people to disinfect things. They may not be able to enforce any quarantines that they put in place. So there's another very interesting point that I haven't heard too many people discuss, is the actual ability of government to deal with this. Now, one of the countries that apparently did really, really well was South Korea. And one of the reasons, according to a number of stories here, one of the reasons that they have such a larger outbreak is because they had apparently a patient 31, which they're calling. Now, this person apparently was warned that they may have it and decided, screw it, I'm going to go to church. And apparently this person was responsible for 80% of South Korea's infections. So that's kind of crazy. I think it shows how infectious this coronavirus is. But again, there's a lot of things that as an individual you can do that you don't have to rely on the government. And that's the, social distancing, staying away from public places, all that kind of stuff. Now, so far we've really just been talking about the spread, but couple other things I wanted to bring up. This one is a funny tweet, funny, ironic, crazy, I don't even know actually. So you guys have probably heard about the person who was arrested for hoarding hand sanitizer. They wanted to sell it at a markup price and hopefully cash in on this real global tragedy. So apparently Twitter gave the authorities his satellite location from when he logged in to Twitter, and they found his storage unit, and apparently they cleaned it out and are now pressing charges against this person. So kind of crazy. I don't know why you need 17,000 bottles of hand sanitizer. I totally understand that there may be reasons to increase the price. There's danger bringing medicine supplies into an area, so it may warrant a higher price slightly. But this, I think, is a bit different. I think most people feel that was the wrong thing to do. Now, the largest issue here is the economy and what do we do after. So that's really what I want to focus on, aside from just that brief review. So we have here this story that the economy would be greatly impacted if truckers were to self-quarantine. So it's not just truckers. It's pretty much groups of workers in specific industries that are critical to the functioning of society, the way that we have it built, are just essential. They cannot go into quarantine. So we're talking about, first responders, fire, police, paramedics, those kind of people. That would be obviously, critical if those people stop showing up to work. Then we have truckers. These are the people that keep the supply lines open. These are the ones that are working those supply chains to restock the supermarkets after people have cleaned it out. Now, people have been cleaning this out because of the sort of spreading panic. It's kind of like dominoes, you can think of it. It's the same way that countries are responding, and it's the same way that people are responding. If you hear that the grocery store is going to be empty, and you're not quite sure when they're going to get food in, even if you yourself are not so concerned about getting the coronavirus, you yourself, you're not worried that you are going to die. You think, I'm perfectly healthy, I'm not in a risk category, so I don't have any problem. Suddenly you're kind of forced into heading to the grocery store and just buying like 5 kilograms of rice and 1,000 pasta and chickpeas and beans and God only knows what else, because you're worried that by the time you need your regular groceries again, that it's simply going to be gone, that everything's going to be gone. It's the same sort of thing that has been going on with different countries, where people have been closing borders, and regardless of what the actual medical advice is, whether or not that's the right thing to do, people have been panicking, closing borders. So on a certain level, it's a chain of dominoes, and it's really hard to tell where this thing is going to stop. So the economic question is, I think, a bigger question than the health question, because even if this thing, which is right now rated about a 3-point-something%, I think 3.8, 3 point something, a 3-point-something% mortality rate, or fatality rate, but there's 100% economic impact rate. 100% of people in each country is going to get impacted. I mean, just imagine certain sectors. So you have, restaurants, cafes, cinemas, all those businesses, all those employees, all of those people who work in the supply chain to keep those things functioning, those people are all going to be affected, and that has domino effect. So, take the entire restaurant, nightclub, bar industry, those, waiters, waitresses, servers, those people, you might keep the restaurant open, for example, just have takeout, suddenly you don't need servers. So those people are not going to be getting their normal salary. They're not going to have the money to spend. They're not going to be able to contribute to the economy either through work or through spending. So that's going to be a domino effect where certain sectors that are connected to each other in ways we don't necessarily think about on a day-to-day basis, they're just affected. And I don't know if really anyone is thinking about this too much. I mean, I would like to think, I would hope that our government is. I don't have too much confidence based on the fact that the Trudeau government's response has been sort of wishy-washy. People have been saying, we're going to close borders, we're not going to close borders, we're going to do something, we're going to act on the best advice of medical professionals, and yet other countries are doing way more than we're doing, and so you kind of wonder, well, what are their professionals saying that we're not saying? Is this just panic? It's a big mess here. But the economic hit is going to be something that's with us even after we deal with the fatalities, even after we deal with the healthcare system. How are we going to recover from this? Numerous countries and people and companies could go bankrupt. So, that's, I think, the biggest question for everybody. Now, I think the last thing to keep in mind here is that when you're, if you're going to be quarantined, if you're stuck home, I think there's sort of a natural limit to that as well for, parents, people with kids. They're now going to be home until well past the end of March break, until, mid-April. So they're not going to be able to contribute. The things and the people, the services, the things that they rely on, they're not going to be purchasing them, or if they are, to a much smaller degree. They're going to get sick of it, to be honest. I mean, people can only be home for so long until they're going to start clamoring for some sort of escape, something to do, some sort of out over here, literally and figuratively. So, the economic hit, and I really would like to see people discuss that a bit better. Feel free to throw down your thoughts in the comments, but, what are we going to do? What is this going to look like? What are we going to expect to see when we come out of our bunkers? What is going to be waiting for us on the economic front and the societal front? So that's, I think, the most critical thing. Now, lastly, just as a public service, this is a nice tweet from Chris Hadfield. Everybody loves Chris Hadfield. He's a great guy. This is about why soap is so effective. I'm assuming this is all correct because it's tweeted out by Chris Hadfield. Now, it's from the New York Times, so take it with a grain of salt. But, here you can see why soap is so effective in destroying the virus. So here you have the form of the virus, and apparently the soap molecules, the soap particles that are hydrophobic, they apparently go into the virus cell and explode it. So that's apparently why soap is doing the thing. And critical to just keep yourself safe, because if if the government is not going to be able to do that for you, make sure that you are keeping proper hygiene, and that you are not letting anything anything get in the way that you could possibly do to keep yourself from getting sick and those you love from getting sick. Now, I do want to wrap up, but before I do, I just wanted to remind everybody that True North here, we are committed to telling the other side of the story and exploring ideas, thoughts, and conversations that the mainstream media refuses to talk about. Now, as you know, independent media in Canada is more important now than ever, especially when there seems to be just a lot of, one-sided stories or information not getting out. And that's why I would ask you to please consider making a donation in support of True North. If you do like content like this or would like to see more of it, please visit www.tnc.news/donate today. And thank you so much. I hope you guys stay safe and, enjoy the rest of your week and your quarantines. Thanks.